Okay. Okay, so thanks very much for your patience there. My name is Brad Newsome. I work here at NIH in the U.S. I get to work with so many of you across this wonderful program, DSI Africa, and I help to lead our research programs here. So not only do I work very closely with the research hubs, but also our new research projects, our more targeted research projects that we're just in the process of finalizing funding now. So DSI Africa represents many different countries across the continent of Africa, and then partners all around the world to really delve into how do we use data science, how do we use AI, how do we push forward innovation for healthcare, for some really new ideas around how we can solve some intractable issues in the world. And our DSI Africa programs cover the gamut, not only across the continent, but also around disease areas and focus areas. Everything from mental health, cancer, to climate change, to surgery, to equitable care. Across the board, we have really amazing people working, and we're going to get to highlight some of those today. So with that, I'll just give a couple ideas around how we want to frame today, and then we'll get started. So our program is broken in this time around to highlighting our research hubs and our research training programs, things like that. Thank you all so much for putting all of your information into the chat. But it really comes down to how do we learn from each other and start figuring out what kind of collaborations may be feasible. So thanks for putting things in the chat. We'll also have about 5 minutes for each of our presenters to introduce themselves and give a short presentation around your organization and what you're doing. If you are wanting to present with slides, go ahead and share them yourselves. You do have the rights to do that. We do have backups as necessary if there are some technical issues, but I do encourage you to share those slides yourselves. When we are going through all of these, maybe let's hold some questions to the end. We'll have multiple presentations, and then let's keep your questions in your pocket and then either put them in the chat and we can come back to them, or save those questions to the end. Because sometimes during these other presentations, you'll be coming up with new ideas of how your question may change based on the other presentations that you hear. So I will turn it over to our first presenter, and we'll get started. We have 3 different people, actually, yes, 3 different people presenting. We'll start off with Dr. Shishom from our DSign program. Is Shishom on right now? I don't know if... I'm not sure if Shishom is on right now. Again, we're doing this pretty in a pretty informal manner. Not seeing Shishom. Okay. Well, while we're waiting for Shishom to make it on, maybe we can move over to our Inform Africa program. Do we have any?
Sure.
Hi, Natalia.
Hey, how are you, Brett?
Great to talk to you. Thanks so much for being on. And if you could give a quick introduction and then jump into your presentation.
Sure. Let me just share my screen quickly. You seeing the right screen?
We do now. Thanks.
Okay, perfect. Thank you, everyone. My name is Natalia Blanco. I am a project coordinator for Project One for Inform Africa, and I will be representing Inform Africa today and all its PIs. So first, just an overall picture of Inform Africa. The goal of Inform Africa is to develop population-scale data streams as a cornerstone of future pandemic preparedness. For that, we're using specifically data on COVID-19 and HIV to start with for Nigeria and South Africa. Our first aim is to establish data streams to understand the multi-layer interactions that may explain the dynamics and impact of COVID-19 pandemic through 3 research projects and 2 cores, supplemented by pilot projects, and I'll get back to that. We also develop, the aim is to develop geospatial tools for the use by country leadership and governments with our industry partner, that is ACRIS. We'll talk a bit about that too. And then in 3 is to expand data science research opportunities through engagement with the broader DSI Africa and through several pilot projects in data science. And in 4 is to maintain and sustain an engagement with policymakers and governments to promote open access to data and redistribution and uptake of any products or any tools that Inform Africa develops. So a little bit about the structure of Inform Africa. As I said, there are 3 projects, 2 cores. The 2 cores are the admin core, the administrative core that is based in the Institute of Human Biology in Nigeria, and then the DMAC, that is the data management core that is based in Caprice in South Africa. The ministry core coordinates the whole grant, the whole hub, and the DMAC is in charge of coordinating and supporting the whole hub in data management and data sharing. And then each of the projects I will talk about next, but each of the projects works independently in collaboration across. And then we're supplemented with pilot projects. There have been selected, I think, 3 to 5 pilot projects that will start later this year. We also have a scientific advisory board made up of industry and government representatives, the countries that and the institutions we receive data from, and a community advisory board that supports and advises throughout the whole hub activities. And we also partner with a LC group, that is the RETSA group that collaborates with us and meets with us regularly. Okay. So let's start with project 1. Talk a little bit about each of the projects. The first project aimed to look into COVID-19 transmission dynamics and risks. The idea is to use different type of data, including COVID sero surveys that were completed in both of these countries, COVID-19 laboratory data, clinical data, sequencing data, and surveys that were done for measuring the adoption of public health measures during the pandemic. The idea is to overlap all these different data types and be able to characterize further COVID-19 transmission dynamics in this context. I'm unable to give you progress for each of them because it's so little time, but I'll give you a little bit on project 2. Project 2 aims to identify whether movement restrictions imposed in Nigeria and South Africa resulted in actual changes to amount, mode, or destinations of travelers using data-driven simulation methods, and to quantify the expected contribution in mobility patterns to infectious disease dynamics. So to give you just a little snapshot, this is out of a manuscript that is already being published, and I put the source, so you please feel free if you're interested to look at the manuscript to understand better the methodology and the results. But just a little highlight. So project 2 employed emerging smartphone-based location data and produced daily human mobility measurements. In this case, daily miles traveled or daily trips, in this case from Nigeria. You can see in the graphs, there is a 7-day moving average of daily miles per person across the early months of the pandemic from January 2020 and then up to April. The lines are states classified by income. So the green lines represent high income countries, states, I'm sorry, within Nigeria. And the blue ones are the low income states. Both distances show some level of increase shortly after the announcement of the first case. The mobility spiked a bit, maybe because people were either, looking to go back to their village or, trying to get ready for the pandemic. But then after the mid of March, when the ban started, the travelers decrease, and you can see that across all the different types of states. However, if we look at daily trips per person, that changes across the different type of income. You can see that high income states travel a lot more. They had more trips per day than the ones that come from low income states. That is in comparison with, January 2020, when, before the pandemic strike. So again, this is a very, very quick snapshot, but feel free to look up the manuscript as well if you have any questions. Finally, Project 3 aims to look at the clinical interaction, epidemiological and spatial interaction between COVID-19 and HIV, using, again, different types of data across the two countries for HIV and COVID-19. For the private industry partner, as I said, our partner is Akros. The main goal for this partner is to help us describe transmission dynamics of COVID-19 via spatial intelligence. They have developed a tool called Reveal that is an open source platform that uses spatial intelligence to drive delivery of interventions. Throughout this process, Akros have included different functions into the tool, and the ultimate goal is that all the different data sources that Inform is using can be incorporated into the tool, and at some point, hopefully, used by the governments as a tool for pandemic preparedness, for example. And this is just an acknowledgement for everybody. Thank you so much.
Natalia, thank you so much for this real quick, but still super informative presentation. Again, the idea of today is all around hearing what's going on across this consortium and coming up with ideas. Not only questions about where you would like a little bit more clarity, but ideas of where we can partner. How do we take these opportunities, whether that's through new partnerships between hubs, new partners outside of DSI that are really wanting to see, how do I align some of my thoughts with what one of our research hubs is doing? And remember that each year, each of the research hubs provides pilot projects where we can really expand the reach within the context of each of these centers. So what Natalia is presenting is all about what their hub is working on to then see where you can partner with them more so, and we can take it to the next level, whether that's through a more organic partnership or potentially a pilot project that you can reach out to everybody on these calls to then learn more about this. You can go to our DSI Africa website or directly to our speakers today. I think Natalia would be very happy to answer more of your questions. We will have more time at the end of our session to answer more questions, but we'll go on to our next presenter, and then we'll come back to that at the end. Thanks so much, Natalia.
Thank you.
So next up, we have our Mediva Center, and our Mediva Center is based out of South Africa and is all about how do you address the complex interplay of multimorbidities and utilizing data science. Is Philani on the call? There, thank you so much. I'll turn it over to you.
Thank you so much, Brad. Hi, everyone. My name is Pelelani Mpangase. I am a bioinformaticist here at the Sydney Brenner Institute for Molecular Biosciences. So today I am going to give you a very brief introduction to our research hub, which is called Mediva, stands for Multimorbidity in Africa, Digital Innovation, Visualization, and Application Research Hub. So I'm just going to go through the introduction, the overview of Mediva and the different course projects that we have. So just before I go on, I just wanted to just briefly explain what we mean by multimorbidity. So multimorbidity, we define it as the occurrence of more than two different types of disease within a person. For example, you can have your heart disease, your Alzheimer, your stroke, and so on. So this sort of phenomenon has been seen to be increasing in Africa, as the study that was recently done in Agincourt, which basically shows that the number of conditions for the different age groups is increasing. And as you can see as well with the different types of categories for these conditions. So this raises a lot of concerns as to what is the actual cause of multimorbidity here in Africa. So the motivation between Madiva is that we're trying to use data science methods to try and get some insight into multimorbidity by trying to basically integrate the population data where we've got your HDSS data sets, where we've got your electronic health records, the genomic data, as well as study data. So we want to try and combine all of this type of data sets using data set methods so that we can try and identify what is the cause of multimorbidity and how, if there can be any interventions that can be put forward. So what do we mean by data science? So in theory, data science seems like this really cool sort of matrix thing that you're looking at, like for this example, this photo that we have here. But in reality, when we're working with health records, so this is an example of what you get from a clinic. You get a patient, and then when the nurses see the patients, they will have to go through this tick sheet and so on and so on. And then the way that this data set is stored as well is what you see on your right-hand side. So it's very difficult when you're working with this type of health records to sort of extract information that you can use to get some informative insight to the different types of diseases that we've got. So this is the main challenge that we're facing in our group, having to go from this sort of old records and putting them into an electronic format that we can use for data science methods. So Madiva is a group that is mainly led by the Wits Institute, and the key partners are the APHRC group in Nairobi, the IBM Research Africa in Nairobi, as well as here in Johannesburg. We also have the Saprin group, as well as the Vanderbilt University. So the main sites where we are getting our data from is in Nairobi, as well as in Agincourt in Mpumalanga here in South Africa. So like I said, we are a group that is mainly formed by many different types of groups. So for example, we've got your Sydney Brenner Institute for Molecular Biosciences. We've got your Priceless, we've got the Wits Biomedical Informatics, as well as the engineering here at Wits, the Chemical Pathology, the School of Computer Science and Applied Maths, as well as Law. So the main goals of Madiva is to try and develop data science methods that could try and have some impact on this problem of multimorbidities that we've got here in Africa. So we are trying to develop some risk model, also polygenic risk scores that we can use for precision medicine, try and understand multimorbidity and the effect it has on public health interventions. Also try to develop tools for visualizing and understanding all the types of data sets that we have from the two sites that I mentioned, as well as understand how data science can be used to support district level health management, as well as also developing novel machine learning techniques. So just a brief overview of the structure of Madiva. So I did mention earlier that our sites are mainly in Nairobi and here in South Africa. So we've got Agincourt here in South Africa, APHRC in Kenya, the IBM Group Labs in Johannesburg, as well as in Kenya. We've got the Saprin Group, as well as the SBIMB. We also have our partners, the Law SA, and we also work closely with the DSI partners, NIH, and so on. So the main components of our research hub, we've got different cores as well as two different research project. So we've got our leadership and administrative core, we've got our data management and analysis core, the DMAC group, and then we also have the training and training capacity development and pilot projects group. And then in our project, we have two main projects. So the first one is the data integration and visualization as well. And then the second one we have is the public precision health project. So I'm going to dive a little bit into all these different cores and different projects that we have. So I'm not going to go into much into the administrative and leadership core. Basically, it's just the ones who are managing the finances, the staff, the policies, as well as the ethics. And so far, all of our ethics have been received. And then we've got the DMAC group. So the DMAC group is mainly responsible for the data management, the tool development, as well as the capacity development. So they are the ones who are basically curating our data sets that we have, doing harmonizations on the data, combining different types of records, making sure that there's no data that is being repeated, because we find that there are some participants who come back more than once when they're collecting this type of data set. So mainly DMAC is the group that is curating our data. So so far the DMAC group has made some considerable progress. So they've finished doing the meta analysis of the data in AgentCode and APHRC, and then they're going to continue now doing the integration of the data sets. And then once all that's done, our data is going to be stored in the VERTS cluster, and it's going to be accessed by all the different type of researchers in our group. And then we're also trying to explore different types of data sets from, for example, from the NHLS laboratory services. And then we have our training capacity and development projects. So here, this is where we've got our pilot projects, the training and mentorships, the ethical and legal training, as well as the translation and capacity building. So, so far, we do have some courses that have ran, and for this year, we do have some that we need to run before the end of the year, the mentorships, the legal ethics policy work. Yeah. And then we also have the postdoctoral sort of training, the seed pilot project, as well as the full pilot project. So far in Madiba, we have awarded 2 pilot projects, one to the Clinical Research Unit of Nanoro in Burkina Faso, and another one to the University of Limpopo, the Dimamo Group. So now when we're looking at our project, so the first project that I'm going to dive into is the data integration and visualization. So in this project, what we are trying to do is we're trying to get all the type of data set that we have available and sort of curate them, link them together, and use machine learning methods to create what we call dashboards. So dashboards are what will basically be available to nurses at the clinics and so on. So this basically just gives you an overview of how the data is looking in terms when you're looking at the different types of disease that we have. So we have been engaging with stakeholders, for example, in Mpumalanga. We've had, I think, about 4 meetings so far. We are also in trying to get meetings with the stakeholders in Nairobi as well to do the same thing that we've been doing in AgentCode. So yeah, so far we've had a bit of some challenges when we are doing this type of work. So for example, like who are we designing these dashboards for? What are they going to do? How are we going to evaluate them, as well as some technical difficulties. And then the second project I'm going to dive into is the precision public health. So in this project, we are trying to create predictive models for assessing multi-morbidity. So again, we are using all these different types of data sets that we've got available to us, curate them, combine them with literature and clinical data. And then the first thing that we wanted to do was to do auto stratification on the data to see what sort of fields do best sort of describe the data. And we are also trying to incorporate genetics data into our machine learning models. So we're trying to put in polygenic risk scores so that we can sort of try and identify, so to build our model for identifying multiple morbidity. So like I said, so far we've done auto stratification on the origin data, and we have had a review that has been submitted at a journal, and we're just waiting for an output from that, and also trying to incorporate genomics data into our models. So just to conclude, so Madiba is a very exciting sort of project, and we are trying to build on the existing work, and are also trying to get new partnerships, and also build our skills and see where this project is going to take us. And then just to conclude, acknowledgements. Thank you.
Okay, Pelelani, thank you so much for this overview. A lot to take in. You all are doing so many pretty diverse, very cool projects. So I don't know if Dr. Shishom was able to join us. Shishom or somebody from the DeSign team, perhaps? If not, we'll move on to some question and answer. Okay, seeing no one from that team, if you are interested in the role that DeSign, which is our more equitable surgery, how do we get more equitable surgical care to more people across West Africa? That's the focus of that hub. If you're interested in that, you can reach out to Dr. Shishom or the DeSign team directly. So, and you can find all of the information about their research hub on the DSI Africa website, the dsi-africa.org website, and you can link out to them from there. So from there, we'll move into some Q&A. There are a lot of people on the call, and you can have a couple options. You can put a question in the chat for the presenters that you've heard from today from Madiba and Inform. You can take yourself off mute and ask a question, or you can put your hand up and I can call on you. Those are our options. Again, this is very informal, so any of them are available to you for our pretty large group. So asking more broad questions or directed question to Natalia and Pelelani is perfectly fine. So anybody, any takers for getting us started with some Q&A? Okay, Jesse.
Yeah, thank you, Brad. This is super nice and very interesting. I really appreciate the very nice presentations by the team. And my question is to Felani about the, multimorbidity and, trying to incorporate to see how you bring the disparate data sources to work together. So have you guys sort of thought of, bringing external like climate data into these, or even other factors, sanitation, water, these kind of things that are you weighing in on this, not individual data, but data from the world out there, from the environment and so on. And we know climate change is a big thing. So have you thought about that?
We haven't really thought about adding in the climate data. I think maybe it is something that we might have to look at it. But so far, we've only been looking at demographics, diseases data, genetics data. But I think it's something that we might have to look at as well. So.
Now, Jesse, Pelelani's group may not be doing as much on that, but the Inform group, so Shifeng is on the call, or Natalia can speak up about some of their work associated with overlaying climate information, as well as our Heat Center, which is on the second stream of the research hubs. That is, that climate overlay on health is completely the focus of theirs. So there's a lot that we could talk about. Xianfeng or Natalia, you want to speak up?
Thank you so much, Brad. This is really, well, I hear a lot of keywords that we're working on, so feel excited. Basically, we are looking at Nigeria and South Africa, and Natalia can chime in too, but we do have a ongoing administrative supplements from NIH encouraging us to look into integrating climate change data with a focus from the emerging weather, extreme weather, such as excessive rainfall, high temperature, low temperature, humidity. So we basically are gathering various data sets for Nigeria, South Africa, using things like NOAA data and so forth to look into the definition of extreme weather condition led by the climate change. And most importantly, we try to link that to our human mobility as well. So we are highlighting human activity before, during, and after these extreme weather conditions, people moving around for gathering essential goods before the emergency, or in some cases, we even see the agricultural related activities are speeding up because of flooding season is coming up on the horizon. So those are interesting ongoing data integration work that we're doing. Then moving on, as our immediate next step is to build a statistical model explaining these human mobility and their impact toward the COVID-19, because we're looking at 2020, 2021 time horizon. So there also are some interrelationship between climate change events, human mobility, and also the epidemiology perspective. Yeah, that's a very quick overview, but I'm really happy to share more details if you're interested in learning more.
Super nice. Thank you very much.
So as an example of, Xianfeng is a great example of how many different disciplines that we pull in to this program to really solve some big problems. Xianfeng is a transportation engineer, and yet he is working with us from the health perspective because, again, when we're trying to tackle something as complex as the health interrelations with climate change, understanding the built environment and the transportation elements of this, just critical for us to understand the bigger picture of this. So DSI is way more than just a lot of physicians sitting around and working with data scientists. It's a big, big program trying to solve some of these big issues. Okay, so
just very quickly, want to add one
yeah.
more thing, Brad. Sorry about that. So Inform Africa team is trying to also build a data hub, basically trying to share our mobility data, transportation data, climate change data that we have cleaned up and integrated with everyone, so you can use. We're also even building a training platform enabled by the pilot projects within our Inform Africa. So be on the lookout in the next half a year horizon that we will be releasing these items if you're interested.
Super nice.
Great, thank you so much. So in the chat, you'll see, so Montserrat put in the chat about the potential, reaching out to some of you on this call about a potential internship, and would very much encourage you all to look at that in the chat and see if you have any ideas of where you could connect Montserrat in, and then there's information about his work in the chat and an email address there. So if you have ideas around a potential internship in the area of data science, Python, the machine learning, data visualization, all of that is there. So please reach out. Okay. And then there are a couple about the link of the portfolio is broken. Okay, so thanks so much for sending that again. Any other questions at this point? We've got some time to have some dynamic conversation both for the presenters as well as amongst the different groups about potential ideas around training, around shared research opportunities, around some idea generation. While you're thinking about that, perhaps I can ask a couple questions to get us moving. And And Jesse, when do the call for pilot project applications come out? This is contingent on the various hubs that you may be wanting to work. All of them have a different process for this because, again, we're doing very, very different kinds of research across the program. So if you want to work directly with Inform or Mediva, the processes are different for how this goes. But we are going to do more work this time around. So our first year pilot projects have all been funded, but for our next year, now those will be spinning up now, and those will be a lot more publicized through the coordinating center. So you'll see that there by following along with some of that information. But then I encourage you, if you do want more information about the specific hub and what they're doing, reach out to them about their timeline. That's going to be pretty critical because, again, there's no strict timeline of every year all the hubs receive pilot project applications in February. It's really diverse with how the different hubs handle this to meet their very specific desires for how they want to use these. Pilot projects sometimes are used for capacity building opportunities, for partnership building, for supporting early stage trainees, for pushing forward a really cool area of innovation that may be developing out of the research that's going on. So many different reasons that these pilot projects are being launched. So reach out to those people. I encourage you. Okay, so any other questions at this point? I would love to know, or to maybe have Natalia and Pelangi speak up about how do you want people to contact you if they want to learn more about this? Maybe can you share your email in the chat, or if you have another way to reach out to your hub, what is the best way to reach you? If people have ideas that are just percolating on this call and they want to reach out to you afterward.
Sure. I can definitely put my email in the chat, and feel free to contact me, and I can direct you to the right PI, the right person in the team to talk specifically. We're also about to launch our website, so I think that will also be a good source for you to contact us and to learn more. That should happen in the next couple of weeks. But yes, I will put my email down here.
Great. Thanks so much. And Pelangi?
Sorry, I'm muted. So you can reach us here on this QR code. So it's just going to take you straight to our website. You can get all the information you need. I'm also going to paste in the chat our website. You can get all the contact information that you need if you want to contact us. But this QR code can take you directly to our website.
Great. Thank you so much. Again, you can certainly also, if people are interested in all of the different programs going on, because again, we have all of our research hubs, our new research, smaller research projects, our training hubs, our targeted training opportunities, our ethical, legal, social implications work, along with our open data science platform and coordinating center that all come together to make up DSI Africa. So you can go to the main website for DSI Africa and then branch out to all of the hubs, or pull up information here. Collins in the chat asked very interested in the work that you're doing in Nigeria with respect to climate data and its impact on health. Collins has an interest in this area. Maybe Natalia can speak to that, or Shenfeng can speak to that from the Nigeria perspective, maybe a little bit more information, and perhaps you can also follow up offline as well.
Yeah, that'll be great. I can send you a few slides that we have presented at the previous round of steering committee meetings. Let me send you my email as well, so you can communicate with me offline, if that works in a better interest of the time here today.
Yeah, again, Climate, Collins, climate and health is a major focus of us here at NIH as we move forward. So we're getting, not only is DSI, a major focus, but now we're adding on more and more opportunities even to DSI or additional opportunities around climate and health, because it is so critical for all of us as we move forward. So, for instance, Xianfeng didn't have climate as a major focus of their research hub to begin with, but then Xianfeng got a supplement to add that in because it's so critical right now. So that's the work that he's doing right now around that climate health intersection associated with the work of the Inform Hub in Nigeria and more regionally. So we've got these evolving opportunities to meet those needs. So yeah, Xianfeng, thanks so much for sending that information.
Yeah, absolutely. I feel I learned a lot too. I not only collected climate data, but also I'm now looking into flooding data in Nigeria. The Niger River has the flooding situation during summertime. Then now I'm working with a few environmental folks looking at the water level data, water gauge data, how to use those information to predict the flooding situation in the area. So that can definitely be another dimension to the data integration, data science here.
Yeah, and how we handle health and providing effective health to people within the within humanitarian crisis, forced displacement, war-torn areas, trying to address needs of the day. We have to be a little bit more flexible sometimes. So any other questions at this point? Thanks, Xianfeng, for putting your email in.
Yeah, absolutely. Looking forward to more communications.
Yeah. So what would you say that if you were giving this information to everybody on the call so you could reach out to potential partners for your future work, what would you say that would be? What are you looking for in a potential partner for future work?
Well, is that a question for me or for everyone?
Oh, no,
to think about?
Natalia Palani. Xianfeng, I'll keep putting you on the spot, but Natalia and Palani?
So with me and our group, so now that we've started looking at polygenic risk scores and integrating this type of data with the data that we have, I think what the type of collaboration that we're looking for is someone who has some background on machine learning and also has some experience with having to use I forget the word, but basically having to use existing polygenic risk scores and applying that to African data set, because you do know that most of these polygenic risk scores that have been developed has been on European data set, and the transferability from that to African data is a bit of a problem. So we are looking for someone who can try and assist us with looking at that.
Okay. Well, it looks like we're getting kicked out. Looks like we're getting kicked out. Emma, ongoing work in maternal health in Ghana or Africa. Yes, but we're running out of time. So perhaps you can reach out to some of our discussants today afterward, or join us as we move forward. But it looks like we're getting kicked out very soon. Thank you all so much for joining. And then perhaps I'll see you